Hi there, my name is Noftsker, and today I will be presenting on tumor-promoting inflammation, a hallmark of cancer in Li-Fraumeni syndrome. So before we begin, I would like to address what exactly Li-Fraumeni syndrome, or LFS, is. LFS is an inherited autosomal dominant syndrome that is predominantly seen within young adults and even sometimes children. The most common cancers seen with LFS are soft tissue sarcoma, osteosarcoma, breast cancer, brain and central nervous system tumors, adrenocortical carcinoma, and acute leukemia. The most common mutation that occurs in those with LFS is within the tumor suppressor gene 53, or TP53, which is responsible for inhibiting the progression of malignant tumors. Most of the time, this is a germline mutation, meaning that it is inherited through family members, although there is still a chance for this mutation to occur de novo or after fertilization has occurred. The chance of passing on LFS to your child is 50% if one parent has it or 100% if both have it. This mutation is equally prevalent within both males and females. However, it is important to note that LFS does not always cause the development of cancer, but it just puts people at a higher risk of developing it. Stats have shown that those with LFS by age 40 have a 50% chance of developing cancer, whereas those at age 60 have the chance almost doubled to 90%. Although LFS can affect both men and women equally, because breast cancer is one of the predominant cancers seen, women with LFS are at a chance of almost 100% of developing cancer at some point in their lifetime. So as previously stated, the most prevalent issue seen with LFS patients is a mutation within the TP53 tumor suppressor gene, which leads to a mutant P53 gene, which is what we are going to be talking about, as P53 plays a role within the regulation of RELA, which is a subunit of NFkB, which is a pathway we will talk about in a little bit, that when not present can result in the transcription or overtranscription of inflammatory cytokines that lead to inflammation within cancer cells. So before I begin, I wanted to delve into exactly what the NFkB itself is made up of. So NFkB is called a nuclear factor kappa B, which is a transcription factor as seen right here. So the first part of this pathway for how NFkB exactly works is made up of two proteins. You have your class 1 protein and your class 2 protein. So our examples for these two is P50 and REL-A. So within your class 1 protein, you have a trans repressor domain, as seen here by TRD. And for your class 2 protein, you have a transactivator domain. So for this protein to work as a transcription factor, this section right here must be deleted in order for this repression to no longer affect the transcription factor that will be later used. And once this part is gone, as seen here, then the transcription factor can be used within further transcription for inflammatory response. So within this picture, we have right here, we have NFkB signaling pathway when there are no signals present as seen here. So when there is no signal present, NFkB is bound to IKB, which is the inhibitor of this complex of the transcription factor, which prevents NFkB from being able to translocate into the nucleus, further leading to no transcription to occur. In the next picture here, we have an example of when a signal is present or a toll-like receptor for this example. So once this receptor binds to this kinase receptor domain, it will cause what is known as IKKB, which will attach to the inhibitor KB as seen in this part right here and phosphorylate it, which then further labels it for ubiquitination, which then allows this protein right here to go into the relocate into the proteasome to be degraded. So because this right here is no longer present, NFkB is able to translocate into the nucleus and allow for transcription of genes that can promote inflammatory responses. So you may be asking now, how does p53 change this? So within a normal p53 gene, there is antagonistic work against NFkB. As p53 negatively regulates RelA, causing minimal transcription of inflammatory genes like cytokines. However, when p53 is mutated, as seen here, it is turned off or the expression is lowered, which causes an increase in expression of RelA as there is no longer that inhibitory factor. And because of that, NFkB is able to be more predominant within transcription and allow for a prolonged transcription of inflammatory genes, which causes more inflammatory response within cancer cells. And these are my references. Thank you.